Doctors or nurses, what is the most obvious case of a patient faking it you have ever seen? Story 1. Paramedic here. A gentleman called 911 from a restaurant claiming that he had a migraine and was unable to see properly. He was literally 2 blocks from a hospital. I've had migraines. I'm sympathetic. On the way to the call, I was planning my treatment plan so that he would be more comfortable during the wait in the emergency room. He was waiting outside, in full sunlight, waving at us, thanked us politely for coming to his rescue, sat in the well-lit ambulance, chatted up a storm, making inappropriate jokes and laughing, stating the whole time that he was 10 out of 10 pain from a migraine, and that only Percocet works to reduce the pain. He has them frequently, and wouldn't you know it, he's run out of his prescribed medication, and his doctor is on vacation. The chef from the restaurant he called from came out and asked for his information, and our patient was unable to pay his bill due to the pain. He conveniently had no ID that he could leave with the restaurant and only had his debit card with him. He promised to come back once he was feeling well enough to tap his PIN into the machine, but right now he couldn't. The chef knew 100% that the guy was full of crap, but couldn't do anything. As someone who has had a vomiting, shaking, vision-affecting migraine in the past, he did nothing to convince anyone he was actually in discomfort. I actually would greatly prefer if he had said, "I ate a meal I can't afford, I'm addicted to painkillers, can you please take me to the ER?" Honesty would have got him better treatment from everyone involved. So we took him to the ER, and he waited in the loud, busy waiting room reading magazines. I'm from Canada, so his ambulance bill is mostly paid by the Ministry of Health. Physicians can sign a patient as non-essential, which would cause the patient to be charged for the whole cost. The MOH has no guidelines surrounding what is essential and what isn't, so the hospital opens themselves up to a lawsuit if someone decides to sue because the doctor signed their ambulance trip as non-essential. So this rarely happens. And add to that, if the patient is receiving social services from the government or has no fixed address, they are charged nothing at all. The studies have been done, and paramedics and EMTs in other countries can tell you charging people does not reduce the frequency of illegitimate 911. Story 2. I'm an audiologist, and it's fairly common to have people fake hearing loss. With adults, it's common for workman's comp and benefits. Children do it for attention or to get out of school for a day, and they are fairly easy to spot. Patients will come in conversing with me very normally, but the audiogram will show a profound hearing loss. We all have our tricks to get them to slip up. Like I like to lower my mic volume to a normal range and mention that they dropped something when they're in the booth. They instinctively reach for it, forgetting that they shouldn't have heard it because of their hearing loss. We can also do an auditory brainstem response, bypassing the need for patient responses. A Stenger test can identify those fakers that only have hearing loss in one ear. My favorite is when testing kids that are clearly faking. Part of the test requires me to have them repeat words. So I present them at a normal volume and the kids are really straining to hear them, and then I slip in funny words like butt crack and watch them smile because they clearly heard it. That sounds like those fake hearing patients are in for a real shock when they realize that they've been caught. I guess they thought they could just play it by ear, but it turns out audiologists have a keen sense of hearing when it comes to detecting fakers. They can't just turn a deaf ear to the evidence after all, and when it comes to those kids faking their own hearing loss to get out of school, I guess they'll have to learn that there's no such thing as a free ear day. Story 3. Paramedic here. I have 3 stories that come to mind. 1. We get called to a local Waffle House for a seizure. We walk in to find a man lying on the floor, not moving, but breathing. We start talking to the waitress, asking what happened. And while talking to her, we occasionally look down at the patient and find him with only one eye barely cracked open, watching us. When he sees us looking at him, he closes his eye. This happens a few times. Then the cops show up and find out what's going on. One of the officers asked the waitress, "Did he eat here?" "Why, yes, he did." "Well, how much is his bill?" $14. At this point, the officer rolls the patient over, finds his wallet, and the guy has a $20 bill in it. One of the officers takes out the $20 bill, gives it to the waitress, and tells her, "Keep the change." We could see the anger in the patient's face when he realizes he's not getting out of paying this bill. He ended up faking a seizure on the way to the hospital. Now, I'm not about to explain how I know it was fake because I'm not going to give anyone any info on how to fake a seizure. 2. We get called to a fall in the women's bathroom in Walmart. We walk in and the manager is freaking out. So we went into the bathroom and to find a white female face up on the floor. I'm guessing she weighs at least 350 pounds. There were 2 friends of hers standing in there with her. I asked her what happened, and she said that she slipped on a puddle and fell, hurting her back. I look all over the bathroom floor. There's no water on the floor, and I asked the manager and the patient's friends, "Did you see any water on the floor?" They all said no. I then tell the patient, "Look, there's no water on the floor, ma'am," and she says, I'm lying on top of it. We're going to have to roll her to her side in order to get a backboard under her and pick her up, I explained that to her. And as we roll her to her side, I check her back for any obvious injuries. I then check her clothing and the floor that she was lying on. Nothing was wet. I have the manager, who is grinning from ear to ear at this point, and the patient's friends look. Do you see any water on the floor? Are her clothes wet? They all said no. We then roll the patient onto the board, pick her up, and place her on a stretcher. At this point, I tell the patient, I'm going to be writing up paperwork for this call and your treatment. Part of what is going to be written up is the fact that you said that you slipped on a wet floor and that no water was found neither on the floor or soaked into your clothing. Now, this is standard. I have to write up what I'm told in addition to what I see. What you need to understand is this. If you happen to decide to take Walmart to court, they can request a copy of my report, and it's going to show what you said and what I found. They can also summon me to testify, and if they do, I'm going to tell them what you told me and what I saw, what the manager saw, and what your friend saw. That being said, do you want to keep dragging this out and go to the hospital, or do you want to just get up from the stretcher and be done with it? She chose to get up and leave. 3. We get called to a 13-year-old having a first-time seizure. We get on scene, and the entire family is freaking out, except for the father. I walk into the room where the kid was, obvious faker. I turn to Dad and have him go outside into the hallway. I tell him the boy is faking, and I ask if anything unusual happened today. The father tells me that he found marijuana in the kid's room, and he confronted the kid when he was starting seizing. I reassured the father that his son was not seizing, and he asked if he could take him to the hospital just to be safe. I said, sure, no problem. We pick up the kid, put him on the stretcher, and as we head outside to the ambulance, he exhibits more behavior that shows that he's faking. Inside the ambulance, I tell the kid, hey, I know that you're faking, and ask him to stop. But he keeps on. The hospital we take him to doesn't have board-certified emergency department physicians. They use general practice and internal medicine physicians. A lot of smaller hospitals do this. I bring the kid in and give a patient report to the internal medicine doctor and the RN, and I say that the kid is faking his seizure activity. The doctor had a problem with that. You can't possibly tell that he's faking. I assure him that yes, the kid is faking. I explain the situation that led up to the faking and that I could prove it. The doctor says, I'd like to see that. Now, the RN knows exactly what's going on and what I wanted to do. He's all for it. So I say to the kid, Bob, we need to get a urine sample from you and we need you to wake up to do it. If you don't wake up, we're going to shove a tube into your penis, run it all the way down into your bladder, and take a urine sample from you. Please just wake up and give us a sample. Nothing from the kid. Okay, Bob, if you don't wake up in 10 seconds, we're going to start prepping you to get the tube shoved into your pecker. 10, 9, 8, 5, 4, 3, 2, 1. His eyes opened wide as saucers before he realized that we caught him. He then closed his eyes, started blinking, looking around the room, and said, what happened? The RA was laughing, and the doc was a little pissed. Story 4. My partner at work is an administrator with an ED nurse background. She was called into the ED one night last year to deal with a patient who was complaining of severe headaches and nosebleeds, but was refusing to go to any kind of examination in favor of being admitted. They were pretty sure at this point that she was a drug-seeking person as she refused to even lie in the bed. My friend left the room and was standing a few feet outside the patient's glass, talking to the charge nurse when she noticed the patient turn around and hunch over. She subtly stopped the conversation so that they could observe. The patient turned around with more blood on her nose and blood on her fingers from where she had been reaching into her underwear and smearing women juices all over her face to fake a nosebleed. Story 5. This is a toughie. It's either 12 or 13-year-old kid was having seizures, would have another every time the ER tried to discharge her, and then magically woke up when her father proposed getting ice cream with no recollection of what happened. The video EEG was negative, of course. Or we also have an old lady pretending to be catatonic and was helping us transfer her from wheelchair to bed. Also, was not limp, but when we held her hand over her face and let go, she dropped it to her side. If she was truly out of it, it would have smacked her. A lot of pain fakers are obvious too, but pain is a bit more gray area, while the above has pretty objectable findings. Yeah, I must say, if I were in that situation, I would have just been tempted to bring the kid some ice cream just to see if that would have cured their seizures. And as for the old lady, maybe she just needed a good cat nap, even if it meant pretending to be catatonic. But in all seriousness, it's important to differentiate between genuine medical conditions and those who may be faking it, as it might impact their treatment and overall health outcomes. You might actually end up making yourself really sick pretending to be really sick. Story 6. Happens every day. A lot of patients in the hospital are in pain, and many for a good reason. We tend to treat them with varying strengths of narcotics. Not uncommonly, people like to take advantage of that, and numerous times I will ask someone to rate their pain, with 10 out of 10 being the worst they've ever had, and it's always 10. Usually accompanied with a lot of moaning and writhing. Now, I make it a habit to stand outside their door and listen and watch before I go in. Almost always, they are just chilling, watching TV, on their phone, and as soon as I walk in, it's like, oh my god, it hurts so bad, ah! Pretty funny to watch, actually, sometimes. Story 7. As an epileptic, seeing all these stories about people faking seizures makes me incredibly angry. In fact, it's made me so angry that I've now got unspecified 10 out of 10 pain, which only Percocet can help with. Side note, to anyone considering faking a seizure, make sure to bite your tongue really, really hard. The more blood there is, the more convincing it is. Bite all the way through it if you can. And always, 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 piss yourself. In fact, just to be sure, it's probably best if you also crap yourself too. Punch yourself in the face a few times and headbutt a wall to get a really convincing mild concussion. And then, when you collapse, make sure that you land directly into your piss. Ideally, face first. Story 8. I've heard a lot of people faking fainting are found out by simply raising their hand above their head and letting go. Magically, these people tend to move their hand out of the way to stop their face getting hit. Similarly, at a summer internship, we get a lot of patients claiming that they're in terrible pain, rolling around in pain, unable to move. Notice the irony. And then 15 minutes later, you see them smoking a cigarette. Drives me crazy. Now, on the plus side, however, that internship when I was out for a smoke break, just an excuse to get fresh air, I was given one of those electric lighters from one of them who just quit right then and there when they got called out. Well, it seems like those fakers got caught red-handed, or should I say, red-faced, to avoid a potential fainting spell. It's amazing how quickly people can recover from their supposed ailments when they think nobody's watching. As for the electric lighter, well, at least something good came from that summer internship. A new gadget to play with. Story 9. There are some fun ones in psych. The patient went into her room and in a very obvious stage voice, just loud enough for us to hear in the main area, started saying random unconnected sentences and phrases. Then she immediately comes out, walks straight up to us and asks, how do I know if the voices are real? She would act perfectly normal when she thought that we weren't looking, but as soon as we walked loudly up to her door, she'd start talking to herself again. Yeah, no, that's not how psychosis works. Good try though. Also, there was a girl who strangled herself unconscious. There was no pressure whatsoever on her throat or neck, and the doctor quietly snuck up to her and then smacked his hands together in a single giant clap. She jumped, and another patient who had seizures, she laid in bed, twitching, but when I called her for lunch, I said, all right, but if you lie there for too long, you're going to get stuck with the vegetarian option. The seizures magically stopped. Story 10. This just happened last week, strangely enough. I've been a nurse for 4 years now, and this is probably the worst I've seen it. A young adult comes in with seizure-like activity. We're a neuroscience floor, so we get those a lot. Complains of severe abdominal pain relating to her seizures, apparently. Now, we run multiple CTs and MRIs that come back clean. We put her on a 24-hour VEEG machine, video EEG for those who don't know, and she reportedly has 100 seizures throughout the night, with full-body convulsions, drooling, upper extremity contractions, and will not respond to verbal stimuli. Post-ictal, she's not lethargic, just confused. Doesn't know her name, the place that she's in, or what time it is, but the rest of her neuro assessment is benign. No bladder incontinence during, had perfect control of her limbs, and she screams for pain meds when she's not having seizures, but is for some reason refusing everything that they offer her. Tylenol? No. Percocet makes her feel weird. Lycoderm patch for her abdomen, it gives her sores in her mouth. I guarantee if the doctor dropped the D word, she would have been all over that. After 24 hours of being there, $1,000 worth of tests being run, all coming up negative, the doctors had no choice but to send her home. Now she becomes agitated and seizing again, while the doctor is basically explaining that she's faking it. He says, okay, I'll wait. She immediately stops. Security had to escort her out, with me in tow, because I was too paranoid that she would throw herself onto the floor before leaving and demand to be readmitted. They recommended an outpatient psych consult for her, which made her even angrier. Lord knows maybe the seizures felt real for her, but she did not need any kind of special help. Story 11. While I'm not a doctor or nurse, but I am a disability attorney, and I've seen a few obvious cases. My favorite was at this hearing office that's a single courtroom, sort of tacked onto the back of one of the satellite offices. The judges come down from the main ODAR office every so often to do hearings there. However, the entrance is around the side of the building, so people often go into the front of the building and sit there waiting, even though I told them it's around the side. So I have this client that did exactly that. She's claiming disability in part because she can't walk more than a few steps, without falling over in extreme pain, uses a cane or a walker to get around everywhere. Of course, none of this is in her records. She originally claimed it was because that she couldn't afford to see a doctor, so I believed her. Well, it comes close to her hearing time, and she hasn't arrived yet, so I go outside to the parking lot to give her a call. No answer, phone already off. I figured that she went into the front entrance, and sure enough, as soon as I started heading towards the front of the building, I see her turning around the side of the building, cane in hand. She doesn't even notice me walking in the parking lot. I go back in to talk to her ahead of the hearing, and suddenly, she can't walk anymore. Yeah, so there were a ton of cases where people can do short bursts of walking or even running, but can't do sustained walking or standing to hold down a light level job. But this wasn't that. This was straight up faking it for the hearing. Now, luckily, she had other mental things that were going on with her that were actually pretty well documented, but it was still pretty funny to see the miracle come running around the side of the building. It looks like your client's miraculous recovery was a real can-do attitude, but in all seriousness, it's always amusing when someone who claims they can't walk suddenly becomes Usain Bolt when they think that nobody's watching. It's a good thing that she had other legitimate reasons for her disability claim, because otherwise her running skills might have landed her in hot water. In the comments, anyone successfully pull off a fake injury or illness for some personal gain?